Hello, it's Joliet Mayor Bob Odenkirk giving our update on COVID. Obviously, there's a lot to talk about today. I do want to thank Jeff Carey, Deputy Chief Carey, Chief Blasky, and the fire department for once again putting the numbers together that we can report to our citizens. Specifically, what we're doing here at City Hall, we have not made any preparations for closing. Obviously, we did back in March, and in April, we closed the City Hall to the public. We do have city council meetings next Monday and Tuesday. We're going to hold those as planned. With the new governor's orders, we are not allowed to have more than 10 people in a room at a time. So although the meetings are open to the public will not be able to sit in the room in the actual council chambers. If someone wanted to make a comment, they'll be allowed to come in, but they're going to have to leave after making the comment. So again, it's in flux. We've dealt with this 6 months ago, and we're back in that position again today. As far as overall what's going to happen in the city, there are no plans either for myself or from the city manager to shut down City Hall or to attempt to shut down the city. We are waiting to see what's going to come from Springfield. As always, we will follow the orders from the governor. There's all sorts of rumors. I've heard them also about the shutdown may be coming. So we're standing by for now. But do want to wish everyone a good weekend, stay healthy, and again, to remind everyone of the protocols. I think we all know them now about social distancing and washing your hands and wearing a mask when you're out in public. Just be mindful that the disease has not gone away. It's come back. It's come back pretty hard. I did also speak this morning. I was on a conference call with the directors of both of the area hospitals, and they reported a sharp increase in hospitalizations. The hospitals are maintaining their caseload for now, but there's concern that if this continues to go up, that the hospitals could be overburdened. So something we all have to be mindful of. And again, this is something we're all in together. But we've been dealing with this since March at one level or another. It's back at a high level, but we are going to deal with it and get through with it. So I just want to thank all Joliet residents for the part that they're playing in this. And again, thanks to our fire department, our city workers, and our first responders that have never taken days off, have not been furloughed or have stayed at home, but have come to work every day through this and are going to continue to do so. I said this back when this first happened in March. Joliet government is not going to shut down. I'm saying it again. I want our citizens to know that the services that we provide, water, streets, police, and fire, we are always going to provide. We are not going to shut down. We're going to get through this. So thank you again, and have a good, happy, and healthy weekend.
Hello, this is Deputy Chief Jeff Carey with the Joliet Fire Department with your City of Joliet COVID update for Friday, November 13th. We get all of our COVID-related information from the CDC, the Will County Health Department, and the Illinois Department of Public Health. You can visit their websites for any additional information. There have been a total of 5,202 residents of Joliet who have tested positive for COVID-19, along with 163 deaths since March. 598 of these positives are from the Joliet nursing homes, as well as 85 of these deaths. The COVID numbers for Joliet continue to climb at a rapid pace. We are still seeing rapid spread in the community. Our 2-week average is now over 1,100. These numbers are almost 3 times higher than they were back in the spring. The local hospitals are still seeing an increase of COVID patients. They now have more COVID patients than at any other time during this pandemic. The number of available hospital beds are declining quicker than we'd like to see and are getting dangerously low. The hospitals do have plans to handle these situations, but we can help them by following the CDC safety guidelines and staying home when you can. We are currently seeing a rapid increase in COVID in the Joliet community. The more concerning issue is the hospital numbers are at an all-time high, and we are starting to see an increase in the number of deaths. We must act now to slow the spread so we do not further overwhelm the healthcare system. We need to make sure there will be beds available for those who need them. We need to stay home when you can, avoid large gatherings, and follow the 3 W's. They are wearing a mask, watch your distance, and wash your hands. Let's work together to slow the spread now so we can have a safe holiday season. With the cold and flu season upon us, it is hard to tell the difference between a cold, the flu, or COVID. If you develop any symptoms, you should wear a mask and isolate as much as possible until you can rule out COVID. Make sure to sanitize any areas that you are in. Even if you do not have COVID, this is a good practice as it will help keep the cold and flu at bay. People who become infected with COVID experience a wide range of symptoms. These can include fever or chills, cough, shortness of breath, fatigue, muscle and body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and diarrhea. You can visit the CDC or IDPH websites for a current list of symptoms. If you are sick and have respiratory symptoms such as fever, cough, or shortness of breath, stay at home and call your medical provider. Keep in mind there is no treatment for COVID-19 and people who are mildly ill can isolate at home. While at home, as much as possible, stay in a specific room and away from other people. Those who need medical attention should contact their healthcare provider who will evaluate whether they can be cared for at home or need hospitalization. If you are experiencing any of the following symptoms, you need to get immediate medical attention and call 911. These symptoms include difficulty in breathing, chest pain, new confusion, inability to stay awake, and bluish lips or face. We can all do our part to help slow the spread of COVID-19 by following the CDC safety guidelines. Thank you for being with us today and have a safe weekend.